Hello, welcome everybody. Thank you for joining us for today's Sight and Soundbites webinar. Today's topic is Future Directions for Artificial Intelligence in Eye Diseases. My name is Carrie Fogel. I am the Senior Director of Development for Foundation and Corporate Relations at the Eye and Ear Foundation, and I'll be moderating today's webinar. We have a great team of speakers today. They're a team of clinicians and scientists working together on an artificial intelligence project for prediction in visual diseases from the Department of Ophthalmology at the University of Pittsburgh. So our speakers today are Dr. Chhablani, Dr. Kiran Vupparaboina, and Dr. Kunal Dansingani. The Eye and Ear Foundation, as you might know, hosts the Sight and Soundbites webinar series every month, featuring different topics related to vision loss, hearing loss, head and neck cancer, sinus allergy, balance disorders, and conditions of the voice. We're really happy that you've joined us. So just a few quick housekeeping items before we get started with the presentation. We won't be using the chat function during the webinar today, and instead we ask that you submit any questions for our presenters anytime throughout the presentation in the Q&A box at the bottom of your screen. Following the presentation, I will be posing the questions to our panelists, and we do ask that you keep questions general and not ask about any specific personal conditions that may not be relevant to all of our audience members. If there are any questions that we run out of time and don't have time to answer, I will send those directly to our speakers, and they will be answered, and we can get those answers sent to your email personally. And following the presentation today, there will be a video available on the Eye and Ear Foundation website. So with that, I'd like to welcome our speakers today. I'll start with Dr. Chhablani, who is an associate professor of ophthalmology at the University of Pittsburgh School of Medicine and a vitreo-retina specialist. So Dr. Chhablani is our main speaker, and his areas of interest are macular disorders and recent imaging techniques. Like I said, he'll be joined by Dr. Kiran Vupparaboina, who is a research assistant professor of ophthalmology at the University of Pittsburgh School of Medicine. And during the question and answer session, we will then welcome Dr. Kunal Dansingani, who is also an associate professor of the Retina and Vitreous Service at the University of Pittsburgh School of Medicine. So we have a great team of presenters today. I'd like to turn it over to Dr. Jose Elaine Sahel, our Department of Ophthalmology chairman and director of the UPMC Eye Center, for a little prep course on artificial intelligence, and then we'll get into our presentation. So thank you, Dr. Sahel, for joining us and for giving an introduction today.
Thank you, Carrie. Thank you, Loni. So I will be very brief because the most important content is going to be given by the team that has been assembled for today. So the department has engaged into a very ambitious program involving artificial intelligence in patient care, because we believe that this can improve the quality of care, but also the decision-making and the follow-up of what is being done. There are now a few examples that have become quite famous about using artificial intelligence in ophthalmology for example, for diabetic retinopathy. Also some very unusual application, but looking at the fundus, you could determine the sex or the age of the person you are looking at, but this is certainly not the most exciting. The most exciting is the development of a tool whereby you can really analyze better the disease, the features of the disease, make the right decisions on the diagnosis and the follow-up of therapies, and possibly predict the outcomes and the best adapted therapy for a patient. So over the past few years, we have recruited an amazing team, and some of the members are today going to speak, and the team is actually growing and is also supported very significantly by the Eye and Ear Foundation and the foundation that are supporting it. So I'm going to hand over to Chhablani, who is leading this effort called Digital Twin, but is also going to describe in general why artificial intelligence is so important in ophthalmology.
Thank you, Dr. Sahel. Thanks for the opportunity. And before I really get started, I would like to thank Eye and Ear Foundation for setting up these webinars where we can interact so closely with our patients and discuss the research which we are doing here at UPMC. And many of these projects are very much supported by Eye Foundation. So let's start with today's presentation, that is future directions in artificial intelligence for eye diseases. I do not have any financial disclosure. So this is what we are going to do in next 25 to 30 minutes, where we will start with what is artificial intelligence, how AI is applicable in routine life, and how AI is changing the ophthalmology field, and what kind of work we are doing at UPMC, and what we look forward to push this field further. So what is artificial intelligence? I know that this is becoming a very common term in routine life, but you all will be surprised that artificial intelligence has been around for more than 35, 40 years, and this is very much part of our routine life. So I just picked up this definition to really set up the base that artificial intelligence is a machine's ability to perform cognitive functions as humans do, such as perceiving, learning, reasoning, and solving problems. So you can imagine that now we are like really trying to achieve many of the things which humans are able to do, and now we are expecting the machines to do, just to make our lives better and become more efficient. So how AI is impacting our lives? So we all are using smartphones, and you are seeing that smartphones have one of the most common applications of AI. We are using social media, Facebook, and including the security and surveillance systems. Amazon is based on AI, where they come up with the suggestions that what could be your choice. And we are using navigations to drive, and the AI is helping us with that as well. And the future is the autonomous vehicles, where we are going to have the cars without drivers, and this is also again based on the artificial intelligence. So AI is very much part of our routine life, and you all will be surprised to know that the Facebook, when we access, and the face detection algorithms which are being used is also based on the AI, where the interest of the image as shown in these green squares is the face, and the AI algorithm is helping us to detect the face. And there are some fun apps which are again available in social media, where you can predict that how you are going to look when you are 60 years old, and the picture on the right top clearly shows that how a young patient is going to look when he's old. And this is again an AI-based algorithm, and many of these image fusion pictures, as you can see on the bottom right, are also based on AI, which are becoming part of our fun activities, primarily on the social media. So let's talk about how AI is affecting ophthalmology. I would not go more in the details, just because we have lots to talk about the research, what we are doing, and what we are looking into the future. So, but before we really talk about AI in ophthalmology, we should know that why ophthalmology is so unique in regards to AI application. So we all know that eyes are almost a window to the body, where you can see so much of, where we can see so much into the body just by looking into somebody's eyes, because this is one of the rare organs where we can see the blood vessels and learn so much about one's systemic condition. And ophthalmology is very much based on multimodal imaging, where we can take the images of each and every part of the eye, and which is again becoming part of our routine practice. And the imaging has advanced significantly last decade or so, where we can perform such high resolution imaging, such as adaptive optics, where we can actually see individual cells. And some of our imaging, such as OCT, is almost giving us the histology pictures, where we can see individual layers of the retina and other structures. So these are multimodal imaging, which is available in ophthalmology, many more. I don't think I can bring everything on the one slide, but these are some of the pictures which we are using routinely. Corneal topography, OCT of the eye, OCT of the retina right in the middle. And you can see some of these fundus pictures, autofluorescence, fluorescein angiography, which is dye-based angiography. And on the bottom right, you have the fundus photograph, that is color fundus photograph, again, giving us a lot of information. And some of these anterior segment images are also shown. So you can imagine that ophthalmology is very much based on imaging, and we are able to acquire images up to the high resolution cellular imaging. So before I really discuss what is now available in ophthalmology field, so let's talk few terminologies which Kiran primarily is going to use. So the machine learning is very much a way where a technique which where we use artificial intelligence, where we are trying to teach the machine, so which helps us in generating a lot of data and a lot of analytical approaches. So machine learning is very much where you really teach the machine that what needs to be done with a smaller amount of data, which helps us in a much larger data set. You guys must have heard about a term called deep learning. Deep learning is a type of machine learning where you are actually not teaching the machine, but you are actually just giving the whole image, and the machine itself is learning out of many, many features which even the human eyes cannot see. So the machine learning is where, for example, you are just defining some features and teaching the machine. So the machine helps you to find those features. But the deep learning, where you are just throwing up the whole image and machine is trying to find the features which is beyond human power, and trying to learn from those features and applying it into a much broader aspect. So I would say the deep learning is something which is much more advanced technique, which is a way of machine learning, which is the most common technique which we are using. So overall, the artificial intelligence, deep learning, or machine learning is applicable in ophthalmology into 4 aspects. Classification, where we are trying to classify normal, abnormal, good, bad, or segmentation, where we are really trying to see that if a specific part of the image is useful, and if I can extract that part of the image, that is pretty much a segmentation. So by learning all these things, we are trying to predict. Kiran is going to discuss a little bit more in detail about the prediction, which is again a most attractive area, particularly to a clinician like me, where I can actually use this classification, segmentation, and all these complex techniques to predict how my patient is going to respond to the treatment, what is the prediction of vision loss, whether this patient is going to progress and lead to vision loss or not. So this is something very, very interesting for a clinician practice, where we really want to understand how aggressive we need to be while treating a patient. And this all definitely helps us to understand and generate more data, which is again a new field which is becoming more common in ophthalmology, that is synthetic data, where we are trying to understand that if we have some time points missing, can we really fill up those time points by generating the time points which are available and learn from them and predict what we can do in future. Some of the common things which I thought I should bring it to this audience is that, just like Dr. Sahel was mentioning, that we can learn so much by just looking at the fundus pictures or the retina pictures as shown in this example, where you can just look at the fundus photograph and predict the cardiovascular risk of patient. This is one of the very interesting paper, which is where they just took the fundus photographs and came up with almost, you can see here, almost the predictability of these patients, that whether they are going to have a cardiovascular attack or not. One more interesting thing which was just mentioned by Dr. Sahel, that's predicting the sex from a retinal fundus photograph. This is again a very interesting paper where they actually train the machine by using deep learning and try to see that whether the fundus photograph can actually differentiate male or female. And you can see that the confidence score is pretty high, more than almost 85 to 90%. And this is again going to be something very interesting, which probably is going to be useful in various security surveillances as well. So let's talk about AI research at UPMC, and I will hand it over to Kiran. Kiran, take it away.
Thanks, Jay. So we have been working on developing multiple models, deep learning models to detect eye diseases such as age-related macular degeneration. So we have been actually developing a comprehensive framework to develop an AI models, right from data collections to training a model. So in the pipeline, the first comes the data management. So in the clinics, the data comes from different sources with different formats, and it is difficult for a AI researcher to collate all and to make sense of the data so that he can train a model. So we developed a data management software where we hosted all the data, images, tabular data at one place, so that it will help us to use those data to develop different AI models. Next slide. So in the AI development framework, one of the important aspects is to have good quality images to train the model. So if you train a AI model supposed to detect a disease on bad quality images, it may compromise the performance of the AI model. So it is important to train on a good quality images. So to that end, we developed multiple quality assessment tools, data quality assessment tools to detect good quality images. And this is one example where it detects good or bad optical coherence tomography images. And this is based on deep learning model. Next. And as Jay mentioned that we acquire different modality images, we call it as multimodal images, and for the same patient. So to develop the predictive analysis tools, one has to actually align all the multimodal data and to train the AI model. So we are also developing these multimodal image registration models where we register 2D and 3D volumetric images to facilitate the AI model development of prediction tools. Now, so the previous two talks for data quality assessment and the multimodal are kind of data preparation tools, and we also develop tools to detect imaging biomarkers, where from the images one can actually look for disease areas and quantify them, so that we can actually accurately detect the diseases and monitor the disease progression as well. So here is an example where it shows the detection of retinal damages. It is called here. What you are seeing is retinal fluids in the eye, which cause the disease, and we detect those using deep learning models and visualize them and also quantify them. Next. So we are also developing tools to detect biomarkers, which help us to develop next generation diagnostic tools. So one such example here is detecting the choroid layer. So the biomarkers based on choroid layers in the eye. So that is one area where we are actually developing new biomarkers to help detect new diseases. Yeah. So now I will give it back to Jay to explain our future directions at UPMC.
Thanks, Kiran. Thank you so much. So let's talk about the future direction, what we are expecting in terms of AI at UPMC. So like Kiran mentioned, that now with the help of Kiran and his team of engineers, we are able to now quantify various biomarkers after database preparation. With the help of these biomarkers, we expect to predict the disease progression like I was discussing earlier. And here is an example where you can see that by using this multimodal image data and combining the patient factors such as age, gender, vitals, we really expect our models to start predicting whether this patient is going to progress further or not. For example, if it is a patient with macular degeneration, so we are working on multiple projects where we are going to predict that whether this dry macular degeneration is going to convert the wet macular degeneration or not, or if it remains dry and if it progresses, how fast it is going to progress, because this kind of predictive analysis is going to help us to offer much more advanced treatment approaches, which such as gene therapy for these patients, and help us to avoid vision loss. One of the very important projects which Dr. Sahil's, I would say, his dream is the Twin Eye project, that is digital twin, where we are going to have this constant model of learning, where we are learning from the patient and getting the data and applying the artificial intelligence to learn from this data and start applying to our very next patient. So it is a continuous learning process where we are learning from each patient and applying to the very next patient. And just imagine that pushing this into today's day of electronic medical records and the imaging which is available now, this is going to be really helping us to treat our very next patient really in a much better manner. So Dr. Sahil briefly mentioned about the digital twin. This is something which we are working very closely on. So the digital twin is a project where we are trying to bring Kiran's expertise of image analysis with advanced imaging from Dr. Rossi's lab, who is working on adaptive optics, with the help of the AI team, which is the team of engineers under leadership by Dr. Kiran, and social determinants of health, which is under leadership of Dr. Andrew Williams, and quality team by Dr. Jhanji, and Dr. Morikin's team on clinical analytics. So we are trying to merge all this information into one and trying to make the digital twin for our clinical care. And now the research and the clinical care is going to merge together and almost working synchronous to deliver better patient care for our patients. And I'm sure that many of you are aware that we have already a new institute set up at Mercy, where we are going to start seeing patients probably by mid of next year. So you can imagine that now we are going to take this digital twin into a hospital without bounds, which is what we are calling this, which is almost like a virtual hospitals where we are going to cover a much larger population, which is not able to come to our big new institute, but with the help of this telemedicine, digital twin, and we are going to collaborate with the Center for Preventive Medicine and merge all these things and start treating our patients virtually and use our satellite network, which is across Western Pennsylvania, and try to make this hospital without bounds, where patients can receive advanced care without even visiting our institute. With this, I would end my presentation. Thank you so much, Kiran, for sharing this talk with me. We are now open for questions and looking forward to more active interaction.
Thank you so much, both Dr. Chhablani, Dr. Vupparaboina, and Dr. Sahil for your introduction. We have several questions that our audience has posed during the presentation that I'd like to get to, but I just want to say this is a project that the Eye and Ear Foundation has taken a lot of interest in. When Dr. Sahil first arrived here, it was something that we worked really hard as a team of non-scientists to understand. And I think the implications that it has for medicine broadly is really exciting. And I know that we are on the forefront of this exciting technology, and using it in a clinical setting is really, really promising. So thank you for all the work that you're doing. And thank you to everyone, from the Eye and Ear Foundation who has supported this work, because we've had a lot of support through the foundation. So I'll start with a couple of questions from the audience. And whoever it applies to, can just jump in and answer it. So I'll start with, is artificial intelligence being used regularly in other fields of medicine, or is this a fairly new technology overall?
Okay, I'll take this question. I think AI is very much is already applied in many fields, particularly the radiology or pathology, where we have the AI models to screen for the diseases and pick out any abnormalities on those scans or even the histology slides. So I think ophthalmology is now, and ophthalmology also has been using artificial intelligence for quite some time. But now that we have these deep learning approaches, which have just become more and more applicable, and I believe the advancement in hardware has made this use in medicine very significantly in the last decade or so. This is why now a lot of our patients hear this AI in medicine.
Thank you. So our next question begins, does artificial intelligence create the possibility of new treatment strategies, or does it mostly give clinicians the ability to identify and treat conditions earlier than they would have usually?
It's a very interesting question, very interesting question. I would say that, yes, right now our focus is primarily to predict the disease progression and to predict the treatment outcome, but we are not far from evaluating or finding the new treatment strategies, and AI is already applicable in drug development, so it is definitely coming along. So we are not far from having the models which can actually simulate the disease processes, and we can evaluate various newer drugs and predict treatment strategies for our patients.
With regard to the experiment done with some of the images and the sex determination, was the sex determination by scan based on hormone targets or something else?
No, it was just based on retina images, that is fundus, color fundus photographs. So it was not based on hormone targets, but the machines were just given thousands of images with some basic training data, and the machines could predict the gender for those images.
Thank you. I wonder if one or more than one of you could expand on how, you talked about the digital twin model, and it's an iterative process with lots of goals and components to the entire digital twin. Can you expand on how digital twin will aid in quality assessment and regulation in care?
Yes, I think this is something which is going to be really a long-term constant learning project, where we definitely are trying to bring multiple components of patient care. So we have really, this was Dr. Sahil's idea, and I really love this idea, because now we are like really moving beyond the clinical features of treatment, but rather involving all components of patient care, including the quality of patient care in terms of the operations challenges, the staff availability, as well as the appointment availability, starting from there, talking about their social determinants, from which zip code patient is coming, as well as their clinical features and the advanced imaging. So we are just going to put all these things together, and we have recruited one more data scientist, Dr. Sandeep. He is actually one of the experts who is going to put all these features together and come up with the predictive power of each of these features, and this is going to change our practice significantly. But obviously, this is going to take much longer than we believe.
Thank you. With regards to the information you presented on one of the slides about identifying cardiac issues through eye imaging, Do you think these advancements and kind of combining disease states will create a more collaborative treatment strategy between various medical specialists who are treating patients?
Yeah, absolutely, absolutely. And I think this is where the medicine is going, where we are like not only trying to get the translational learning processes from other specialties, but also it is going to lead to a good collaborative efforts. And now you can see that in my last 15 years of practice, I am now seeing that many of the primary care physicians have the fundus camera where they can actually do the diabetic retinopathy screening in collaboration with their ophthalmologist colleague, or where we can get the fundus photograph evaluated. And this is where the medicine is going to go. You probably are going to be sent to another specialist just because they are able to screen much better with the help of these advanced techniques.
Thank you. Someone asked if the digital twin project would be more like a limited clinical trial, or is this something that all patients who are served by the UPMC Eye Center, would they be all part of this research endeavor?
I would say that it has really gone beyond the research, or it has gone beyond the clinical trial, because we are going to learn from everybody, which we are anyway doing in our clinical practice as well. But as a clinician, I can confess that I'm still not aware of many of the parameters which are influencing the treatment outcome. We are just trying to put this together, and this is just going to be a great learning for all of us. So I would say that each and everybody, we are going to learn from each other.
Thank you. Thank you so much. Let me look for a couple more questions. We have several, which is great.
I see that. This is exciting.
I know, a lively.
I'm glad that we did not do our presentation for long.
Right. I mean, I think this is a hot topic in science and medicine broadly. So thank you for talking about it today. We have a question that says, what about existing retina diseases like retinitis pigmentosa? Can this act as a predictive model for those, or how do you see that functioning with a disease like RP?
I think yes, because I'm sure that many of our audience are aware that now UPMC is going to be one of the leaders in inherited retinal diseases, and that is being led by Dr. Sahil and his team focused on inherited retinal diseases. So with the help of this digital twin, this also is one of our target diseases at very early stage, where we are really trying to bring the genetics component as well as the imaging and trying to predict the progression of this disease, which is certainly going to help us to offer specific gene therapy for our patients.
I'll ask 2 or 3 more questions before we end today's talk. So we have a question that asks if using artificial intelligence to determine the image quality would be able, could scientists, you might collaborate with, if they could apply it to improve the yield of rate for scans?
This is something which Kiran is currently working on. Kiran, I would let you speak about your project on quality assessment and then improvising the image quality.
Sure. So we are working on multiple aspects actually. So the quality assessment we are performing not only to detect good or bad that we'll use for to train other AI models. Also, one of the goal is to improve the screening rate also in the clinics, meaning in the teleophthalmology, if they when kind of scenarios where multiple images will be captured by I mean, not so expert there. There will be technicians will be on the field. There will be so out of them, so helping them to acquire good quality images, that is one of the goal. And other is to, even if they acquire a low quality image, how to improve its quality to be so that some diagnosis can be performed based on those images. So we are working on techniques called as super resolution techniques, where we are developing those models where we can actually increase the resolution of the images and improve the quality of the images, so that so even the low quality image can be used.
Yeah, and I think that Kiran's team is now working on super resolution, which is certainly going to help us to improve all multimodal images, and which can be used not only for research, but also for the clinical application as well. Thanks, Kiran.
Thank you. So I'll ask a couple more questions to the team. One was about robotic surgery, and I apologize, I'm looking for it. Oh, here we are. UPMC is well known for their work in robotic surgery. Is this type of artificial intelligence something that could be potentially paired with robotic or autonomous surgery to make procedures less invasive, more hands-off, kind of all beneficial things for patients?
Yeah, interesting question. I would say that I'm really not the expert in this area, but I understand that the AI is very much already in the field of robotic surgery. And obviously these algorithms are pretty much used in these robotic surgeries to reduce, or I should say to improvise the accuracy of these surgical techniques. So I think the ophthalmology field, there are a couple of robots. Robotic surgery has been there in eyes for a long, long time, but the recent last decade or so, there have been one or two companies which have really come up very well for robotic surgeries for the retina particularly. So I'm sure it's going to just make it better and better.
I think I'll ask one more question, but it is in two parts. What, long-term goals, for a digital twin and, perhaps even beyond digital twin, does the team have for this project, the goals that it has for patients, and why is Pittsburgh and the university kind of the most natural place for this work to occur, the best place for this work to occur?
So now I would just give the answer to the first part, and I'll leave the second part to Dr. Sahil. So the first part is that where do we really look into the digital twin and the whole landscape of AI at UPMC, is that the last few slides showed that, we are really going to take this digital twin forward into the hospital without bounds, where we are really going to start helping patients, those who are really far from us, the same way we are going to start the education as well as various ways of telemedicine. So I would say this is just a beginning of using AI in this field. And I would say the dream would be really to have hospitals without bounds becoming a reality. So Dr. Sahil, why do you think Pittsburgh is a hotspot for AI research now?
Well, maybe just to echo on the previous question, it's certainly not a limited approach. It's supposed to be really totally integrated with the whole care, both incorporating the social determinants of health, the quality process, the monitoring of the activity. So it's not just a small trial. It's really totally integrated to the improvement of the assessment and the quality of care. Why Pittsburgh is the best? I think we'll have to prove it. I think the main reasons is that we are really in a place where the strength of institutions like Carnegie Mellon or Pitt in the field of artificial intelligence is unparalleled. We have also been able to assemble a very good team with the people that are on the screen today with Kunal, Jay, and Kiran, and also now recently Sandeep and others that have been recruited. Probably the reason why we could become the best, one of the best places, is because of the holistic approach that we have to integrating artificial intelligence in patient care, applying to any aspect of the validation, the evaluation, as we, the example being, for example, the social determinants of health, why some patients are at risk of not being able to come back for follow-up, and how this could be predicted so that you can make sure that you don't leave a patient outside of a loop and don't follow. But importantly, the people we have recruited have a strong experience, and the ones today on the screen and others, and also because at UPMC we have 20 years of track record of electronic records. So this is one of the first institutions in the world that has incorporated the electronic records, and we have an analytic department at UPMC that is extremely strong. So all of this gives opportunity to really bring AI to the next dimension.
Thank you very much for that, Dr. Chhablani and Dr. Sahel. I think that was my last question. We kind of encompassed several answers, you know, as we went through the list of questions from our audience. If anyone else, if any of our speakers have anything they'd like to add before we conclude today's webinar, I'd invite you to do that. And if not, then I just want to thank all of you for taking the time on our lunch hour to share the exciting model of the AI project and the implications it has for patients, you know, not just with vision loss, although that's what we're focusing on, but broadly for health in general. So I think I'll leave it there. Thank you all for joining us today. Have a nice Thursday.